Hi there, this is Steve Roy. I'm an ICU fellow at the University of Calgary. Just going to show you this differential multiventilation setup so that you can build one to allow for more safely ventilating multiple patients with a single ventilator. So starting at the ventilator and working our way back, you can see that our ventilator, we have a inspiratory pressure set to 25 centimeters of water and a PEEP set at 5 centimeters of water. In our inspiratory circuit here, it's divided with a T adapter. The T adapter goes to our two patients, our test lungs, our yellow patient and our clear patient. There's also another T adapter that connects the inspiratory and expiratory ports of the ventilator, and that allows the bias flow and normal behavior of the vent when the pressures are modified in the individual circuits. Without this section, and many systems do not have this section, there is much less predictable behavior of the ventilator in response to these individualized circuits. Next, we have the first patient's inspiratory circuit. It goes to a PEEP valve enclosure. You can see the PEEP valve inside of the enclosure. This inline PEEP valve enclosure allows us to set the inspiratory pressure independently for the patient. So here we have the pressure in the PEEP valve enclosure set to 10 centimeters of water, and that's subtractive from the 25 centimeters of water on the ventilator. This resists flow of 10 centimeters of water, so the patient receives 15 centimeters of water instead of 25. Following this to the patient, we have the patient, or our test lung in this case, and a manometer. The manometer can either be a digital manometer, which we can see here on the screen, are two different patients. The patient on the left in the blue and the patient on the right in the red. This is can be displayed in millimeters of mercury rather than centimeters of water. Alternatively, you can use an ET tube cuff manometer, and that will have a dial and can be used as an alternative and is centimeters of water. However, it doesn't give you the waveforms, and here I just wanted to demonstrate the difference in waveforms. So our two test lungs, the one on the left is getting an inspiratory pressure of 15, and the one on the right is getting an inspiratory pressure of 25. You see that the volumes are proportional, as you would expect. And they are also getting different PEEP pressures. So you can see that the PEEP on the left is 10 and the PEEP on the right is 5 centimeters of water, and the effect that has on the test lungs. So these two simulated patients are getting completely different settings, and those settings are do not interact and are independent of each other because of the PEEP valves and the bias flow circuit, which are critical to this setup. Following the expiratory limb back, we have another PEEP valve enclosure. We can see the PEEP valve in there. It's set to 5 centimeters of water, so it's resisting flow before 5 centimeters of water accumulates in the expiratory circuit, and then the flow directed out of this goes to the vent and is again resisted by 5. So 5 plus 5, we get 10 centimeters of water, and hence our 10 centimeters of water of PEEP for the patient on the left, compared to our patient on the right, which has a PEEP set on the expiratory valve there of 0, and so it ends up being just the 25 of inspiratory pressure and the 5 of PEEP in the right test lung. So that's pretty much a overview of this system. Of course, if you have any questions, please feel free to contact me at the email address below. and I'd be happy to answer any questions that you have. Thanks for listening.